Welcome back. Some scientists and policymakers say South Africa's approach to its COVID-19 vaccine program has been characterized by a large number of missteps. In aggregate, they say it has left the country behind many others on the continent and essentially left millions unvaccinated, as a third wave, which has been described as savage, descends on the country. This has also happened despite an established vaccine procurement and distribution network, access to the first large batch of vaccines on the continent, and a large number of pandemic and vaccine experts agreeing with this view. Professor Alex van der Heever is a chair of the Social Security System Administration and Management Studies, Adjunct Professor in the School of Governance at the University of Witwatersrand. He joins us now. Very good evening to you, Professor. This comes as a statement is being sent out by the IEC that the voter registration for the local government elections will now be postponed for another 2 weeks. How significant do you think this is, before we get into South Africa and its handling of COVID-19, how significant is this, especially against the backdrop of some political parties saying perhaps we should wait until we are out of the woods to even hold local government elections?
I think that this is probably a correct move for the time. We're still in the middle of a very severe wave. And for many provinces, the wave is still on the upswing, although there's some vague possibility that Gauteng might have topped out. So I think that it is important, but I do think that the electoral processes and these mechanisms can have protocols implemented that will minimize the risk to people if they are developed properly and implemented. So I'm not sure where they are on that, but it appears that they haven't developed that, which means there are safety concerns about registration.
So, as I mentioned in the introduction, that you and a group of other members of academia, scientists and commentators have characterized our handling of COVID-19 and the vaccination as that of missteps. Talk to us about this and why you have reached this conclusion.
So there's been, right from the sort of toward the latter parts of 2020, it was clear that there were sort of very odd decisions being made about the vaccine strategy. Firstly, there was a huge amount of silence, no clarity given on the overriding approach, and some public statements about participating in COVAX. And that raised a number of concerns that government wasn't actually taking the vaccine strategy seriously at that point. And I think that that's really been borne out. So when you start to examine what's happened since around about August, September last year up until now, you see that government has had a lot of choices, a lot of decisions that it could make. And in many cases, they have been quite strange and also excessively cautious in a number of instances where, in fact, there was a need to be fairly pragmatic. And this is really the concern, is that there's a suggestion that there's a problem with the decision-making process, how people are thinking about the problem. That's if we had to take the statements at face value. There might be underlying reasons that are not very healthy, that are behind these very odd decisions. But if we take their positions at face value, the decision-making has been very problematic and has put South Africa at risk.
Some of you have questioned if there really is a tangible strategy. If we could just look at it within context, by this I mean the arguments made by government saying on the basis of limited data and information, they couldn't start negotiations on acquiring vaccines unless they knew the developers, etc., etc. But we are where we are now. South Africa, in Africa, having the highest number of cases, and we mentioned acquiring the first large batch of vaccines. So why do you think we find ourselves where we are, and just how bad is the situation?
Well, I think the situation in terms of vaccine procurement and rollout, we're in a far better position than we were in January. The only problem is that there was a concern that our vaccine program would only get going in the middle of a third wave, in the middle of the winter wave, which is exactly what has happened. So this vaccine's rollout at this point is not going to impact substantially on severe illness and death. And that's the problem, is that if we had been earlier by 3 months, we would have had an impact. So going forward, we have to make sure that when we go look at ongoing transmission, further transmission of at significant levels for the remainder of the year, we do have to create this separation of the link between severe illness and infection, and which happens only with vaccination. That means that we do have to carry on vaccinating at scale. But the question now is whether our strategy also still now takes into account the acquisition of doses at scale. It's unclear exactly when we will get all of our doses at scale, and whether or not we are now negotiating for further doses that will take us beyond the amounts that have been indicated publicly so far, and whether or not our procurement strategy moves into the realm of updated vaccines which address vaccines of concern. So we've raised also the fact that there's a number of contingent risks that now need to be taken into account. That is the possibility that the current range of vaccines might not impact. This is only a contingent risk, might not impact on severe illness and deaths for emerging variants. And if that is the case, we need to have an approach to deal with that rather than just standing still and assuming it's not going to happen.
So those are just some of the key factors that you say we would need to consider when we look at vaccine failures. But there have been other unintended consequences or miscalculations, which we've spoken about. And I'm sure you'd agree that as much as we knew how deeply entrenched inequality is, we just didn't see it widening as much as it has. Vaccine inequality. Vaccine inequity, but inequality in general as well.
Internationally or domestically?
Domestically, because we are looking at South Africa.
So the domestic situation is that there would be a problem naturally for people who are income compromised in being able to pay for vaccines, which means that our vaccine strategy had to be available at no cost to the bulk of the population. That is the model that exists now, and the rollout plan is not distinguishing, although there is a distinction between public and private, not because of the private sector, but because government is not creating an arrangement. But there is a free vaccine available to everybody. So that rollout strategy as it exists now, I think, is penetrating all communities, which is very positive and very good. It's just very late.
All right. Thank you so much for speaking to us. So Professor Alex van den Heever is Chair of the Social Security Systems Administration and Management Studies, Adjunct Professor in the School of Governance, University of Witwatersrand.